Phil, who takes our minutes and does a great job. Thank you, Cheryl. So maybe our next slide, what we want to do is just quickly, I'll read through the agenda and then again, maybe do some quick introductions. Our first item is, of course, introductions and a brief collaborative update that I will cover on behalf of Lindsay. Secondly, we will go into the regular updates of the AOA grant for year 2, which Connie and Lindsay Blackwelder are both on the phone, so they can fill us in there. Our third item is to review, again, our centralized referral system and let you know an update on that and how that's going. Item 4 is Flora. She'll share with us our data entry and data submission updates, whatever she might have along those lines. Item 5 is our regular updates on any leader trainings that are happening statewide. That would be anybody could provide input on that. And then, of course, item 6 is our marketing spotlight. That is an opportunity for any of us, and Connie as well, if you want to mention something that's happening or some marketing tool or resource you're using that you want to share with the collaborative, that would be great. And then item 7 would be any additional items that anyone might have. And then, of course, we want to just mention right from the get-go, because we never know who might have to leave the call. Our next meeting is scheduled for Thursday, May 1st from 9 to 10:30. All righty? So I'm going to move right into the introduction. So maybe once again, let's just go around the room, go around the phone, and make sure we know who all is here. And this also helps Cheryl kind of confirm our attendance. So I've mentioned the 3 of us here from COA. Someone else?
Connie Young with Department of Human Services.
Thank you.
Hey everyone, this is Lynn. Go ahead.
Sorry, that's not working.
Yeah. It's always a challenge on the phone. This is Lindsay from Central Colorado AHEC.
Okay.
And this is Crystal from the Southeastern Colorado AHEC.
Thank you. Welcome. Melissa?
Hi, I'm going to get off mute here. This is Melissa Pruitt from Boulder County Area Agency on Aging.
Okay.
Samantha Decker with the County Health Department.
Okay.
Kelly McCracken from CDPHE.
Thank you, Kelly. Who else do we have? Did we get everybody? Is that it? Okay. There you have it. All right. So we wanted to just remind everyone to, once again, if you haven't recently, checked our selfmanagementcolorado.org site and make sure your classes are posted and updated. Again, this is just a monthly reminder that classes cannot be posted if we don't have all the exact information. So be sure if you have sent us information that it includes the start date, the time of the class, location, all that kinds of detailed information. Otherwise, the system doesn't accept it. So this is just a friendly reminder to all of us. But there are quite a few classes listed, so that's exciting. I think everyone's getting rocking and rolling on it. The second item is, if you haven't yet as well, check out the new tab across the top. If you go into that website, you'll see across the top, home, classes, providers, and partners is the tab that we hope that you'll have a chance to look at. Within that tab, there are 3 subcategories, and webinars is one of them. And of course, on there now is our Non-Disclosure Privacy Act webinar, as well as all the meetings that we do. And the first 2 meetings that we've done as a webinar are on there. So if you ever want to go back and look, as well as, of course, Joni will post this one as soon as we're finished. And then forms, any kind of statewide collaborative forms that you might be looking for are posted there. And then a members list of all of the collaborative members. So it's a great tab. It's kind of fun to see all that information. And we're really getting snazzy here, I'll tell you. So check that out. Any questions on that tab? before I move on? Okay. So the other thing we wanted to mention is we did have an opportunity to present, both Lindsay and I, out at the NCOA ASA conference in San Diego. It was a beautiful week. And we co-presented with Albert Trillian. And he is the new Senior Director for Clinical and Community Partnerships out of NCOA. So that was a really great session. It was great to meet him. He's a neat guy. And we have the opportunity to have him come back in June, or come to Denver, I guess I should say, in June. We're sponsoring a workshop I'll mention later. But anyway, you'll all get a chance to meet Albert coming to Denver here in June. But that went very well. And I know Melissa did a session on, I think, more on falls prevention, was it not?
It was on trying to bring falls prevention into a community setting, and and I worked with Victoria Panzer on that with her program.
Yeah, I might note, Melissa, I know Lindsay shared the other day that she was on some national conference call, and someone had attended your session and said it went really well. It was one of her favorites. So there's some feedback you may never hear.
I certainly did. Well, that's very nice to hear. Thank you for sharing that.
Yeah. Well, yeah, you bet. And our session went well. We had a good attendance. It was on expanding referrals in a clinical setting, and so it's definitely a topic that's of interest on a national level. And then, of course, just an update that Albert Trillian as well as Mary Brick will be here in June to work on to help us lead the COA workshop, and so we look forward to that. So our second update then brings us right to Connie and Lindsay, and any updates you might want to share on the Year 2 grant of AOA.
Okay, thanks, Chris. This is Connie. I am happy to report to the few people who are on the call today that we finally did get approval for the carryover request, carryover funding request. Each step of this process has taken a while, so it's definitely later than we thought it would be, but it's still good news that that everything was approved. So I thought I'd just run through the highlights of what was included in that request. And the one that affects the most people is the number of additional completers that were added to our contract, and that's 130 more completers for this grant year. So I'll be working with Lindsay Blackwelder on identifying which license holders those will go to, and then Lindsay will be working with those license holders to create new MOUs or addendums or whatever. I do want to let people know that we will be needing to track that a lot more closely than we did last year, in part because it came down to the wire last year, and that wasn't a good situation for making decisions ahead of time, and also because we have only about 4.5 more months this grant year. Anyway, so Lindsay's giving me good news about a lot of people are really on top of things and offering classes and planning them, and that's great. There are others that appear to not have any classes that I can see planned at all, and that is a concern. And so we'll be working, tracking that and getting in touch with people who have completers on the books, but if it looks like they're not going to be using them, we want to be proactive and find a way to make use of them, so that hopefully we can reach all of those folks before August 31st and don't have to do another carryover request for that. But we'll see. But anyway, that is the good news, that we do have those additional folks. So also, COA, you all know this, but just for everybody else, COA, our contract with COA focuses on the work that they do with embedding CDSMP into various medical practices that are federally qualified health centers or practices that are working to become or are patient-centered medical homes. So we were able to put in funding for COA to work with 3 more of those entities this grant year. So that's good news as well. I also put in, as I mentioned on the previous call, travel reimbursement for 1 in-person meeting of the collaborative, and it's just for the license holders who participate in the grant that I would be able to cover their travel, and for people who are coming from far away, like Grand Junction or Elmosa, et cetera, then they have money in there for an overnight stay as well. On that note, if we had talked about when that meeting would be, that you would do 1 in person, and I did get the impression that some people thought it would be okay to do perhaps 2 in-person meetings, one that would be reimbursed where license holders who are working with the grant would have their travel costs reimbursed through the grant, and maybe one where we might all come together, but everybody would be on their own dime. So I don't know if what the thought is on that, or if there's enough people on the call to talk about that. But as far as the one where we would be in person, that the grant funds would be paying for, I would suggest planning that for June, because it was the idea was to get the sustainability consultant on board. And since I'm just now working on getting all of the contract, it's not really a contract amendment, but changing the contracts with COA and AHEC to do the additional work, and I have to get the consultant on board and all that, I think that would be good timing for that. So that would be a suggestion for that meeting. Now, Chris, I don't know, do you want me to just go through everything and then come back for questions, or do you want me to see if people have comments or questions? I'm sorry?
It might be helpful to do questions while you're on the topic, I'm guessing.
Okay.
Are there any questions on this?
Any questions? Anything I've said so far?
This is Lindsay. At one point, we had recommended doing a SurveyMonkey in order to get some feedback regarding when, where, how for that in-person, face-to-face meeting. I haven't seen the links for that. Has that been done?
No, we're going to need to do it in Denver because that's the least expensive way to do it, and it's a $3,000 item as it is. So to limit the number of people who have to travel, that was the way to do that. As far as when to do it, if we want to consider what day of the week or how to split up the times, we could do that. As far as like doing it all in one day or 2 half days with overnight in between or whatever for people who are traveling. But as far as when we can get it done with this, because of the sustainability consultant coming on board, then there's not a whole lot of flexibility as to, what month to do that in.
Connie, this is Kelly. Is there a tentative date for that?
No, I don't have any, unless you want to. It's hard with so few people on the line to know, to try to get input other than doing some kind of a survey, as Lindsay mentioned. But I don't know, Chris, what would be the normal date for June for the collaborative meeting? Or would you want to do? Would you want to
look and to see, because we're talking May as the Thursday meeting, which puts June the Friday meeting, if I'm not mistaken. The first Friday of June would be Friday, June 6th. Is that a date that people want to consider?
Well, have we determined for sure, like Connie said, there's options if we want to do one full-day meeting or half-day Thursday, half-day Friday, let people get back home, good time Friday? I just feel like those are things that maybe we should send out on SurveyMonkey, so maybe not the month, maybe not the location, but definitely a little flexibility on dates, one day versus half day.
Yeah,
that would be fine with me.
I'm sure it's a big difference between getting on a webinar call for an hour and a half than committing to a day and travel and so forth. So is that a SurveyMonkey something that you'll do, Connie, to get a date? Or?
Yeah, I can do that.
Or Meeting Wizard?
I can do that. Well, I haven't used either one, so but I'm more than happy to figure out how to do it. So, yeah, and I'm guessing
we can do that from here as well, if need be.
Okay. Well, we can touch base and maybe
okay.
I can see. I know different people have done different Survey Monkeys through the state, so I think we're able to do that. I just haven't done it yet, but but I don't know if for the people who are on the call, if there would be anything that would be completely out of the question. And of course, it's hard to get everybody, you know, it's usually impossible to accommodate everybody, but with so many people, but
this is Crystal from southeastern Colorado, AHEC. I know the week of June 23rd is out, so that's not around the time of the normal collaborative call, but just throwing that out there, that week for us would not work at all.
Okay. Okay. Thanks, Crystal.
And I'm going to just comment from COA's perspective. We do have our, that's the weekend we're doing a big collab training, that workshop where Albert and Mary are coming in for. So that Friday, it would be tough.
Which Friday?
June 6th.
Is it just that particular day?
Yeah, because it goes into the weekend, so I don't see that's a conflict. The workshop is the 6th, 7th, and 8th.
Okay.
It starts Friday evening.
Okay.
So just our input.
Okay. No, that's good. That's especially good to know. So that if we don't want to do it that day, I don't want to ask, would you like to do it that day? And then say, oh, we're not going to do it that day.
Right.
It's always good to know those things ahead of time. Okay.
Do you guys have any idea about the time frame for the actual meeting? Whenever thinking about the length of time, if we wanted 2 half days or 1 full day, is it going to be a full 7 or 8 hour meeting with a consultant?
I don't think that part would need that much time, but when we talked about it before on this call, people were, you know, saying that, you know, it wouldn't be really worth their time to travel from, you know, for an overnight for a, you know, 2-hour meeting. But if we had the typical, I don't know, you know, Chris, you can chime in here too, but if we had the regular collaborative business for an hour and a half or thereabouts and sustainability stuff for, you know, maybe a half day, so maybe it'd be, you know, 3/4 of a day or something along those lines, or what, Chris, do you have any thoughts from that collaborative perspective or other people on whether if you know, come together in person, does it make sense to spend more time on something that we don't typically deal with on the phone?
Well, this is Mary Pat again from COA. I do think you're probably on the right track. I think if people are going to travel, they want to make it worthwhile. And we could certainly add to the agenda, but at the same time, I'm not sure where Crystal's going, but if I were traveling from afar, it's nice to be able to think you could go home that afternoon. So if it included a morning, maybe over a lunch hour, and you were finishing by mid-afternoon so that you could travel 2 to 3 hours and get home that evening, does that sound doable for folks?
Yeah, and I think where my thoughts were, if we did 2 half-day meetings, like from Pueblo, I don't know that I would want to drive up for 2 days. But with the grant funding, I don't know if there's money, since we're so close, for an overnight stay for us, whereas definitely Grand Junction, whether you did it 1 or 2 days, they would have to stay overnight. So I guess that's where I'm going with it. For folks that are 2 to 3 hours away for the overnight, I don't want to use grant funding unnecessarily for overnight stay. Does that make sense where I'm going?
So, Crystal, do you mean like if we started late and ended early, so that you'd have, you know, are you saying you'd be willing to get up at the crack of dawn and drive in early and then drive home afterward if it were not a full 8-hour day, like if we were starting at, say, 9:30 and going till 3
like
or
9:30
something
or
like that?
10, yeah. Yeah.
Yeah. Well, I can definitely ask about those options, because that's, that's a reasonable request or suggestion. And I'm sorry, I thought Chris was on the phone. I keep saying Chris. Is Chris? Mary Pat, is Chris not on the phone?
No, she is not. She's
okay, I'm sorry. There was at one point somebody said I'm such and such from COA, and I didn't hear who the such and such was.
Oh,
so I
no problem.
Your voices sound a little bit similar on the phone, so.
No problem.
So it's just Mary Pat and Cheryl from COA?
Oh, it's Mary Pat, Cheryl, and Joni. Joni Saunders.
Joni, okay, that's who I missed. Okay, all right, thank you. Okay, well, no, that's a good suggestion, Lindsay, and I appreciate you wanting to hear what input from people. And I'm sure for those of us that are in the metro area, we can be more flexible than people who are needing to travel, either from somewhere like Pueblo, in Crystal's case, or folks that are further out. Okay, anything else before I go on to next one? Okay, we did get funding again for all of the things I requested, but one of those, just to let you know, was the additional books and CDs for people who had offered classes last fall, license holders who normally could get grant reimbursement, but who didn't because the contracts were not, the new contracts were not in place. So for those license holders who let me know that they did offer classes and how many people were enrolled in those classes, I will be able to order books and CDs to kind of support the work that you all did last fall, or at least part of it. My thought on that was that I could, may be able to just order those and have them all shipped to me and then bring them to the June meeting and hand them out in person there. So I'll look into that if that seems simpler, I'll do that. Any questions on that?
Connie, this is Mary Pat again at COA. My question is, in getting those qualifying for a book and CD reimbursement, as you're talking about, do they still have to meet the eligibility criteria of 60 plus and a completer? Or
not a completer. They need to meet the 60 plus or disabled, but I did it based on enrollment because you have to buy the books when people enroll, not after the fact. So
okay,
yeah,
okay,
it's a little outside the realm of what we normally do, but in consideration of the fact that people were offering classes and thinking that they were supposed to be reimbursed, and that they did the classes and all of that. We're just trying to support that. But just to reiterate, this probably won't happen again.
Sure.
And we are, the money is to go for completers, and our contracts are very clear with the state government that we don't pay for things that happen before our contract is in place and the subcontract or MOU with AHEC is in place. So, this is an exception to that. But I did explain what we were doing in the proposal to the Administration on Aging. So there's no secret about this, and we talked about it internally within DHS as well.
So just again to clarify, is this for classes that started after September 1st?
Yeah, I had asked people. I'd sent out an email to everybody on the collaborative, the membership, to tell me which classes they provided with their own funding last fall, and so I put in the budget the number of books based on those responses. So I'm not opening it up to new people now. If you didn't already tell me, then I didn't put anything in the budget for it.
Okay.
So it's based on the people who already responded last fall. And
okay.
if you have questions about whether you're on that list, I can talk to you. Let me know later. We also put in for the online program to start that up for a total of 50 completers. They have different rates based on enrollment versus completers, so we're going to go with the completers. And so once that's up and running, we'll let you know that that's available. I put in money to do a marketing brochure at a minimum for state level use, because I really have nothing I can use when I go to talk to anybody, so I feel you know, it's really not a very professional approach to just have a fact. I mean, a fact sheet is good, but I need something a little bit more jazzy, so put some money in for that. We are supporting part of the cost of leader training for folks in Grand Junction and Alamosa in response to a request from Monica Wolf in Alamosa and Sue Conry in Grand Junction. So we're making available part of the cost of that for primarily for the leader fees, and they are supporting the other costs. I also have quite a bit of money in there for fidelity checks, not just COA, but for others. And I'm thinking that I don't have any invoices from anybody to date. I know some people don't want to do that or don't feel like that's appropriate because it's already covered in some other of your own funds, and that's fine. But that money is available for people, for license holders who are participating in the grant. And if you want to submit those invoices for fidelity checks, then please start doing that. Otherwise, that'll be another pot of money that I look at and go, well, I got to move it somewhere else so that we can try to avoid or at least minimize any carryover requests for into year 3. Anybody have any questions about that? Okay. Let's see. I also have, this might be, I forget if this is in the carryover or the regular year 2 grant money, but I did want to let you all know that we do have, there was plans made even before I came on board to have a physician, kind of a physician champion of CDSMP to do a half-day webinar for other docs through the Colorado Foundation for Medical Care. And I have $1,300 in the budget to pay that kind of person to do that. COA is working on seeing if they can identify someone through their network, but in talking with Lindsay this week, she said to please go ahead and open that up to other folks. So if you all have any, or people who hopefully listen to this conference call after the fact, if you have any doctors in your network that really love CDSMP and would like to do a webinar, like talking to other folks, and want are looking to make the consulting fee that we would be legitimately paying them to do, please let them know, and then let me know if there's an interest. And if we get more than one and we can choose from a couple people, that'd be even better. But I want to get that done. I'd like to get that done this grant year as well. So and that takes a little bit of planning time. So that would be great if anybody has any ideas. Is anybody who's on the phone have anybody in mind? Darn. Okay. Well, I'll maybe try to. I'll work with Lindsay McIntosh, and then just see if we need to reach out to some other folks that might work with some physicians on a regular basis as well. But if anybody has any ideas, please let me know. Then also the last thing I guess would be that I'm working with COA and some other folks to do some training that will be done primarily by COA in 2 geographic areas. The original idea was to work with the area agencies on aging that had federal grants for care transitions, and it was a grant from CMS to improve care transitions and reduce Medicare expenditures for hospital readmissions. So they were looking at people who'd been discharged from hospital to home, and their care transitions grant helps those people reestablish it in their home environment and works with them for about a month. So we were looking at providing information to the people who work with those individuals on how CDSMP can help after that first month where they're in the more acute phase of recovery. So we're doing that with Denver Regional Council of Governments, the AAA there. They still do have a Care Transitions grant. And so we met with them a couple weeks ago, Mary Pat and Lindsay and I, and had a really good meeting with them, and we're excited about that coming together here soon, we hope. We're also, we also had a call with some folks in Grand Junction. They used to have one of these grants, but theirs expired, but so we're taking a little bit broader focus there and working with Hilltop, with Sue Connery there, and with Brittany with Mesa County Physicians to outreach to a variety of providers in the area that will be the Area Agency on Aging, but also the physician network that Brittany has with Mesa County Physicians, with home care providers, and some other groups that work with disabled individuals. So that will again be on CDSMP and how it can help with care transitions, but also just how it can help people remain independent as well. So hopefully we'll have some good news to report back after that takes place, but I'm excited about that. That is everything I had to report. Anybody have any comments or questions on anything else? Okay.
All right.
I'm going to stay on the phone for a little bit, but I am going to sign off no later than 10, but because I'm off, well, technically, after I'm done with this call, I'm off today to go to the Rockies game. So thanks for hearing me. Yes.
Any other questions for Connie that anyone might have in case she's off the phone before we realize it?
Connie, this is Crystal from Secahec.
Hey, Crystal.
For the Fidelity invoices, can you tell me how much is it per Fidelity check?
Well, it's not a lot of money, but that was decided one of the first calls I was on. It's I believe it's $100. Is this right? $100. It's kind of funny. It's $100 if the visit is like 100 miles or less, and if it's, no, I don't have that in front of me. I'm sorry.
If it's over 100 miles, it's $200.
Okay, so 100 miles is sort of the split when it's 200 above. Yep. If the travel required is over 100 miles. So it just kind of supports some of the cost of doing that and some of the travel costs. And there are forms that we need to have you send in to get set up to do electronic funds transfer and to report the classes. And I did send a revision out to everybody a while back, but if you want me to send that to you again, Crystal, I can do that.
Okay, Connie, I'll probably talk with you offline. I have a couple of questions, but I'll call you.
Okay, no problem. Yeah, and next week would be good since I won't be there today. But yes, that'd be great. Well,
yeah, I'm leaving today at noon for not the same reason, but still leaving at noon. So next week.
Okay. I hope it's a good reason. I mean, a positive reason. But
it is. Yes.
Okay, good. I didn't mean I hope you have a good reason for leaving work early.
That's not how I took it at all.
Okay, good.
But not as fun as a Rockies game, that's for sure.
Oh, yes. Well, it depends if they lose miserably, then you never know. Hopefully that won't happen.
I might, just to piggyback on this discussion real quick, to remind folks that Lindsay, as the collaborative chair, keeps a file of those who have completed the Fidelity core training, so that if you are sending someone out to perform a Fidelity visit, that they have completed that wonderful webinar that Sue and Holly and Lindsay put together. and you view that. It's a couple hours, and then you have a form that you need to get a copy to Lindsay on, and we keep those master forms so that everyone who's doing fidelities has gone through the training that they put together. So that's just a reminder. If nothing else, then I shall move on to our next slide. Again, this is just a reminder of our centralized referral system, and you can see there where it says partners along that blue bar in the middle, and that was the one I was referring to earlier. So this is what it looks like now. We love to see all those lovely red dots on the map, which is indicating where classes are being held, and when it's nice and full like that, it's rewarding. And we do know folks are accessing this, and particularly I know as we're working more and more with the RICOs, even Kaiser, even some primary care physicians, they'll go on this website and see where classes are located, and if you toggle over one of those red dots, it pops up the location, and then you can get more information about it. So it's really, Joni's showing you. It's powerful. No, wait, you can't see that. Never mind. But anyway, it's a great tool and resource for us to have. So we wanted to be sure and remind you of what that looks like. And then on our next slide, you'll see these are the 3 different methods and that we're offering folks to be able to submit a referral. Certainly, we're still seeing faxes as probably the predominant method. However, we're definitely seeing some more and more activity in electronic records transfer, which is done through a secure system here on our website, as well as they can email online, and it goes into a secured email that we pick up here at COA. And so we're seeing some more use of these other methods, which is really exciting. So just a reminder that these are available, and they're all HIPAA compliant and so forth. Any questions on those? Just wanted to confirm that that's available on that Colorado Self-Management website. And then the last piece is just, again, to remind all that this is what the referral tracking looks like when it comes into our office from the Statewide Collaborative, that we will track, and it gets put on a nice little referral log as you see before you. These are just examples of people. I don't think Scooby-Doo actually is taking a class, but anyway, what kind of information we can track and provide back to the folks who have sent out the referrals, if they're looking for information, how's that going, what actually happened. This gives you an opportunity to see. So just again, this is available. It's a great selling point if you're talking to folks who are doing referrals and they want to know, well, whatever happened with the one I sent, we have that information. So we wanted to be sure everyone was reminded of that. And then the next slide is, I'm sorry, question?
Real quick, this is Kelly McCracken from CDPHE. I had spoken with Lindsay about starting a subject, or rather a topic on these meetings about the number of referrals you all are receiving through the CDSMP Statewide Collaborative Referral System, and then where those referrals are going. That's going to start to be shared at these meetings?
I've got some slides coming up with some information. So yes, I think that's the intent, if I'm not mistaken, and we can certainly follow up with Lindsay if this isn't exactly what you were looking for. But we do have a couple more slides coming up that will share that information.
Great, thank you so much.
Nice segue, thank you. So our next slide just gives you, again, just sort of the bullet points of what we do here. The COA can track the referral source, it can track the class that the participant was enrolled in, the number of sessions they attended, and any other kind of pertinent information, that demographic information that might be pertinent to any of you or to someone who's doing the referral. And we were just talking about how we are tracking right now, and it's kind of a pilot project, but we are tracking our RICO referrals and the outcomes and what's happened with that. So we'll go into and show you how that has panned out for us. So statistics through March 30th, Colorado Access, which is certainly our largest RICO, incorporates 3 different regions. we have received 26 referrals. And this, I might note, this started when Connie and Lindsay and Kelly, I think, might have been in that presentation as well to Colorado Access. So this started generating some referrals. We have had 26. 23 of those have enrolled in classes. And then you see that that's an 88% of referrals that were enrolled. That's phenomenal. That's very, very high. Then we had 18 of those 23 that enrolled that actually showed for a class, the first class. So that's a 78% of enrollment. And then 15 of the 18 completed 4 more classes. So that's how that reads. So we had an 83% completer rate of the 18 that started. And then off to the right, you see where they actually attended. So we had one that was referred to a primary care practice that was holding a class in Aurora. There was one that went to a Kaiser class in Lakewood, 3 that East Kaiser, 4 that went to Kaiser Centerpoint, Aurora, and then 9 that participated in a class that was held at La Familia Clinic. So that kind of breaks down those 18 folks. Does that kind of give you the information you were sort of looking for? Kelly?
Yeah, I think it looks great. What about the rest of the folks? Is there any more information that you would like to see from these referrals?
This is Connie. Unfortunately, I can't see the webinar part, but do you have on there who the license holder is? Because sometimes, you know, that might not be clear.
Okay.
Based on the location or the organization.
Yeah. We could add that.
That would be helpful to me.
Okay. I will definitely pass that on to Lindsay, and Joni does a lot of that work. So does Cheryl, actually. We can add the license holder on those, the classes that they actually attend, because it was, obviously Kaiser as a license holder had quite a few, and then a couple others were COA, and who knows what else could be.
Mm-hmm. And if they were like Kaiser, this year Kaiser would actually be under COA's license, right? Because there's not a
and these are
separate.
These are figures from last year when it was still Kaiser's.
Right, right.
But yeah, yeah, we could definitely see. There's been some leads, and we would have that information. We can tell you what kind of referrals came in that we suggested to classes. I know I personally did a couple that were, Tri-County had a class in Northland that I made a referral to. It didn't pan out. So we were just following, I think we were just showing you the Colorado Access referral. And then the next page, you'll see the results from AF Williams, which is a Colorado Access provider. And they have referred 19, and this all, again, was generated from that presentation that was done. So 19 referrals have come in. 16 were in 2013, 3 in 2014, and 8 have enrolled in classes. 2 have already completed their classes, and you can see off to the right that was one of them was in La Familia, and one was recently in the Wheat Ridge Active Adult Center class. And then we have a class starting today as we speak at AF Williams, where 6 right now are enrolled. So that's sort of the results on AF Williams specifically, which came through the statewide collaborative referrals. And then my next slide shows you Physicians Health Partners, which is part of the, they work with the RICO, the Colorado Community Health Alliance RICO, and they've had 1 referral. And I know we're working with them on, they're going to actually conduct their own training in chronic disease self-management in May. And they really want to mainly train all of their case managers and that sort at that level about chronic disease self-management. So rather than just a one-day presentation, they really want them to get it and understand it, whether they're all actually going to be active leaders at some point. So they're very much getting on board with that aspect of doing more referrals and getting classes and so forth. So those are some of the highlights of the data. We can certainly go back and look at adding the license holder. And then just in general from the website, we've gotten 3 referrals. And those are like the one I mentioned, for instance. Just tends to be challenges and barriers and so forth, but we'll keep working on it. The nice part is those referrals then get put into our database. We always go back, and if a class comes up again in that area, we have opportunity to do follow-up so they don't get lost. So
Mary Pat, this is, sorry.
Oh, go ahead.
This is Connie. Did you say that Physician Health Partners is planning to do their own leader training in May?
Correct.
Okay. Well, that indicates a level of commitment.
Yeah, because I think, yes, who's that?
Melissa?
Yes.
I have a question about when you said general. What do you mean by general? I'm not clear, like a general referral. Is that somebody who just calls for other things, or it's just general?
Yes, it's somebody who has done a self-referral. They've either just came across the website and made contact via that way. They can send us an email, and say they're interested, they want more information. And so it's likely that's the way. Also, though, we have gotten one of those, I know, was a primary care physician that informed the patient about the website, and then the patient made contact directly, based on that. So it's kind of that word getting out, and then some of it is just folks who are finding it. Maybe they Google self-management, and they get on the website.
Okay. I don't know if this fits into our discussion anywhere, but you've heard me the most fact that it's hard to get people to sign up for classes, blah blah blah. But do you think it would make any different impact if we all just called it the same thing? And this may not fit into the discussion right now, but it's just something that's on my mind. It's a little frustrating.
I think that's a really valid question, and I wonder, Connie and others, if that might be a good agenda item for the on-site meeting in June.
I think that's a great idea. To be honest, maybe this is me, but I didn't realize for several months after I was in this job why there were that a lot of these classes that were on the website that were called different things were the same thing. So, and I'm sort of an insider, so if it's confusing, I think it's tough when people have branded their classes a certain way to consider unbranding, but I think it would be a worthwhile discussion to have, different ways of how we could deal with that.
I mean, I think if you're trying to appeal to the general public, having the names that are a little more catchy makes sense. But if you're trying to tell physicians and get them to refer, to have all these different names, I think is very confusing. So anyway, that's my piece, and I apologize for getting out of order here.
Oh, that's not out of order. I know Lindsay has shared with me that on the collaborative website, it's all under chronic disease self-management program. And so when they first go in, that's the verbiage that's used. It's broad.
Yeah, but
then if they click on a class, and in that particular site or organization or license holder has a different name, that's where it shows up.
Right, but I'm just thinking about if you go into a doctor's office and you're saying, we want to tell you about chronic disease self-management, but we call it Be Well, and then, I don't know. I just think it gets more confusing than it needs to be. So.
Okay, yeah, I think that might be a good discussion to have with the group. That's my suggestion.
Yeah, I think that would be good.
All right. Anything else on that? I think overall we just want to let everybody know that there's movement. There's movement. It's just like our action plan. Small but steady growth. So I think our next topic is Flora to update us on any kind of the data information.
All right, good everyone hear me? I'll take
Are you there?
Can you hear me?
Ah, now we can.
Okay. Can you hear me?
Yes?
Yes.
Okay, sorry. I had to go off on mute because there's some background noise here, so I didn't know if I was muted or unmuted. Anyway, good morning. So really there isn't much to report on the data entry or data submission side. Everything's looking good. It's coming in a steady stream. I checked in with Lori who enters the data, and everything's going as usual. And then the other side of the update would just be about the CDSMP, DSMP training. That's finally here, so I'm just doing some last-minute preparations for that, which is going to be this coming week, April 7th through April 11th at the Holiday Inn in Cortez. I believe you all received an email from Lindsay at COA with the registration information, and so I'm not sure I got any registrants from your organizations, but if there's any last-minute interest, we still have a few spots, so let me know. Email me.
This is Connie. Could I ask Flora a question about that?
Sure.
Sure.
I was just wondering how many folks from the tribes were you're expecting to take the training?
It looks like we're going to have about, let's see, tribal, I think like 10.
Oh, that's great.
Yeah. So that's pretty exciting that we're going to get that participation.
Mm-hmm.
Yeah, that's great.
This is Kelly, and I just want to put in a big plug for the work that Flora's done to arrange this training. She has done a tremendous amount of work to bring in both tribes. She's recently worked with an organization called SUCAP down there that has also now joined the training and is bringing on Southern Ute members to be trained. So there'll be representation from both the Ute Mountain Ute tribe and the Southern Ute tribe, which is really kind of it's a big accomplishment. And so, I just want to thank Flora, and I also want to thank Southwestern Colorado AHEC for their participation as well. The tribes will be actually working under Southwestern Colorado AHEC's license, and Southwestern Colorado AHEC will be providing the fidelity checks to both of the tribes. And then the last thing I wanted to say was, I'm not sure if everybody got the news, but the leader of the the leader of the Southern Ute Indian tribe recently passed away, which is obviously a very big deal. And so we're keeping our fingers crossed that the Southern Ute members will continue to, or will come to the training next week. But he did just this last week. So anyway, hats off to Flora. This has been a tremendous effort, and I'm so happy it's finally coming to fruition.
Me too. Thank you, Kelly.
Yeah, that's awesome.
Does anybody have any data-related questions?
This is Connie again. Not a question, but just on the work with the tribes to give Kelly some pats on the back too for all the work that you did to get it to the point where you handed it over so well to Flora, because you've been a champion in that area since I've been working on the grant, and obviously before that. So I really appreciate your work with that. It's really exciting to have that come together. But you deserve some credit as well.
Thank you so much.
Kudos. And Flora, you did get the leaders from Access Health System in Cortez, correct?
Yes,
okay.
We did. I think 3 of
Awesome.
them.
That is so awesome. I really appreciate that.
Yeah, thanks for referring them.
Yeah, that's an area, an isolated area at times, and so when they have something plop in their back door, that was exciting. So thank you very much.
Yeah.
All right, so you see on the slide also then mention of, I know there is scheduled, it's tentative still, with Monica and Alamosa for another CDSMP and diabetes cross-training in the Alamosa area. I don't know, Monica's not on the line. Connie, do you know any more on that?
We're trying to get the paperwork going on that, and I haven't heard back. She was, Lindsay McIntosh and I communicated, and I also communicated a bit with Monica just to see where things were, but we've got to get that in place before it's scheduled. But it is part of the funding that I was referring to earlier with the carryover that is what's going to pay for the leaders' fees. So, you know, and I know Monica's really excited about it, just haven't gotten all the I's dotted and T's crossed in order to get it scheduled, but it's still in the works. Okay, awesome. I know initially the dates were kind of set to be towards the end of April, so I'm not sure if that's going to stay put, but okay, good. All right, I don't know. Okay, that's fun, yeah. And then we are doing a chronic disease self-management training here in Lakewood in June. And along with that, this is again that implementing evidence-based programs in patient-centered medical homes is the workshop we were talking about earlier with Albert Trillian and Mary Brick coming in to be leaders in that. That's going to happen that weekend in June, as I mentioned. So we look forward to that. And then we also, and Connie's already mentioned these are the some other updated trainings that are coming down the pike. And this is that connecting the CDSMP series with care transition programs. And so Grand Junction has set their date for May 9th. Again, this is speaking to an audience of staff who are case managers and navigators and frontline point people, et cetera, that are going to learn about a chronic disease self-management program and how it would benefit these individuals that have completed that transition time. And so again, also looking at scheduling a date with the Dr. Cog folks. So we're looking forward to that. And then that will definitely, out on the Western Slope, you know, plug folks we hope into Hilltop's programs out there. And then Denver regionally, whatever classes are posted, then they would be able to take advantage of. So that's a great collaborative effort going there. Marketing is our next topic. Any marketing highlights, Connie, or anyone else that want to share something they've done that's been successful recently? I didn't have anything to share this time, and I also thought it would probably be beyond the time I'd still be on the phones. Okay. But if anybody has any success or stories or questions for others, I'd love to hear those. Yeah, that's the advantage of networking and collaborative. Yeah. Well, doesn't sound I feel like Farrell Bueller. Anyone? Anyone? All right. Well, I'm going to go ahead.
Sorry, this is Crystal from SECAHEC. We're getting ready to do a workshop in Pueblo for DSMP, and so I am planning to use Monica's suggestion of taking flyers to the local pharmacies and to see if they will attach those. So I know she's not on to hear, but I thought that was a great suggestion, and I'm excited to see what we get by using that. Oh, that's great. So, that's really cool. And then I'm also wondering, whenever the discussion earlier about the self-management Colorado and getting people to use that and even general referrals, I'm wondering on, like, I'm just processing this, if we put something on our Twitter account and other organizations did just to tell people, hey, check it out, that might be a good way to throw information out there. Okay, that's a great idea, Crystal. So,
this is Melissa. We're going to, eventually, it's just been a very slow process. We had prescription pads that we used once before for to give out to physicians, and it will have Matter of Balance and some of our other fall prevention programs, and then the chronic disease self-management. I was going to put the website on there as well, so hopefully that will help. Great.
That would be. Do you have any of those left? Even one that you could
have them made yet. You can't imagine what a frustrating process this has been just to go through
really?
the process. But they are almost ready, and I will send you one just as soon as I get it done. Okay.
Okay.
I can send you, Connie, I can send you what it looks like at this point, but it didn't have the referral to the site, and I wanted to put that on there, so that's what I'm waiting for. I just need to get that done.
Yeah, no, that'd be great to see once you have that done.
Okay.
Well, I am going to sign off. Thank you, everybody, and we'll be in touch.
All right. Thank you, Connie.
Okay,
enjoy your day.
Bye-bye. Thank you. Bye-bye, everybody. Have a good weekend.
Bye. And actually, the only other item we have is additional agenda items. Anything we haven't covered. You've already given some good suggestions to add to future agendas. And then, of course, a reminder of the next meeting being Thursday, May 1st, 9 to 10:30. But anything else, anyone?
You know what? This is Crystal from Southeastern Colorado AHEC. Is it possible for somebody, maybe Flora, you know the cross-training for CDSMP and DSMP, when we just went through the leader or the master training with Stanford, they said it needed to be 5.5 days to do that. But I see you guys are doing it in 5 days. Is there any way somebody can just send me the agenda, just a list of items you do to get it all done in 5 days? And I'm sorry, that's kind of outside the scope of this, but still I'm interested.
Sure. Who's this?
It was Crystal.
Can you hear me?
It was Crystal.
Okay.
Yeah.
All right. I will send that to you.
So you're wondering how they are doing it in 5 days as opposed to 5.5, correct?
Right, right. Because Stanford said it should be 5.5.
Yep, you're right.
And so, and then whenever you guys report back to Stanford, do you, because with the license holder fees, you get a set number of leader trainings. Are you counting those cross trainings as 1 or 2?
When you say you guys, do you mean CDPHE?
CDPHE or whomever is offering
We're
the training.
We're not licensed. We're just helping. Southwest is actually the license holder, and
okay.
So they're going to be the ones who do all the reporting, and it's the T-trainers who have this format who figured they could do it in 5 days. So I'm not familiar with that rule of the 5.5 days, but they've been doing it for a while, and I guess they figured out how to do it in 5.
Okay, perfect.
But
I'm sorry that
Crystal.
Crystal, it's Kelly. I just sent your email over to Flora so she can send you that agenda.
Perfect. Thanks, Kelly.
And I apologize. This is Mary Pat again from COA. I do not know the exact answer to that question, whether that's considered 1 or 2 trainings was your initial question, but I can certainly let Lindsay know or if someone else on the call knows. I'm assuming it's 2, but that's my own assumption.
If I'm understanding correctly, yes, it is true, 2. So they'll get certified for the CDSMP and then also for the DSMP cross-training.
So in reporting to Stanford, that would show us 2 leader trainings.
Right. That's what it's under. That's how I understood it from Stanford. But I know there's a set number of leader trainings you can do with your license.
Okay.
And as the license holder, so I just want to make, for those that have done it before, I'm just picking brains, that's all. So.
Sure. Yeah, I know we've counted it as 2 if I'm not mistaken, but then our license may be a bigger package deal, so to speak, you know, where we have a larger number of leader trainings that we can provide.
Right.
So that might be the difference that in licenses.
Well, and, you know, and I'll just come in and say as well, you know, there's everyone, including Stanford, who's been a big part of this effort as well down in the southwestern corner of our state with the 2 federal tribes. You know, they're working hard to make all of this work, to work time frame that they need to do it in and to make it as simple or as easy as possible while still meeting all of those requirements. So there could be some things that are happening that maybe aren't standard. Does that make sense?
That does, yeah.
It does.
Yeah,
I would agree.
Yeah, we've had to. It's like that's why I wanted to give Flora such big kudos, because it's interesting. You wouldn't have ever expected that setting up a training would take as long as it has, but it has been a feat. And and to get to this point where we're about to execute it feels good. So
I hear you. I am sure they're very excited in Stanford as well as you are to be reaching that population. So
yeah, Stanford's thrilled. I mean, they're on board with all of it as well.
Yeah, I'm sure that they're very excited to have training happening. So yeah, makes sense.
And then one other thing around other agenda items that I just wanted to bring up. I'm definitely interested in a SurveyMonkey, and I know Connie's off the phone, but something going out to get feedback for this in-person meeting. So also feedback on agenda items, topic items. I think this is a great opportunity for all of us to get together and really talk through some things, including marketing and just the marketing of self-management in general, and maybe even starting to talk a little more about the other evidence-based programs that are out there, like the Diabetes Prevention Program, and how people are considering co-marketing these two programs. I would be very interested in that discussion. So, as we develop that survey tool, I'd like to give some input into some of the questions, and I'll get with Connie as well, but I just wanted to put that up.
And in my limited knowledge and experience, I'm thinking that does sound more like a SurveyMonkey tool than a Meeting Wizard, because I think that just gives you meeting dates and times, where SurveyMonkey you're asking maybe for topic suggestions, to be included in the questions. Yeah, and we can still keep it pretty simple.
Yeah, ranking interest, that kind of thing, yeah.
Okay. And then addressing the date.
Yeah.
Okay. Okay. We will definitely have Lindsay probably follow up with Connie, and maybe you too, Kelly, then, and to get that tool going.
That sounds perfect.
Yeah, the sooner the better. Obviously, we're already into April.
I know, the year is just flying by already. It's crazy.
Oh my gosh. Let's not go there. So we posted up the next meeting date and time. Our final slide really is just contact information once again. Any other loose ends before we wrap it up on a Friday morning?
When is that again? May what?
May 1st. Thursday, May 1st.
Thank you.
9 to 10:30 again, just to alternate and honor that sometimes Thursday, sometimes Friday request. And it's possible then, it looks like maybe the June meeting may not be Friday, June 6th. It might be another date. I'm assuming we would just incorporate this all into one day in June, not have both. Okay? Going, gone. So everybody have a great weekend. And look forward to seeing you guys in May.
Thank you.
Thank you.
Goodbye.
Have a good
Bye-bye,
weekend.
everyone.